So today we are going to have a conversation with Fausto and Panos on healthcare system, on what are the pain points and what are the action plan we need in order to improve the efficiency of the healthcare system.
We are living in unprecedented time. And when we live such a period as we are living today, on top of everything, to have something like the COVID crisis, that meant a huge stress on the system, which already had some fragilities. Because one of the problems that we faced with this crisis was the fact that many of the other diseases, they were in a way neglected. And we have data now coming from different places, from Europe, from Asia, from the US, showing that there was actually not only an increase in mortality in the number of people who died globally or in total, but also the outcome of diseases like heart diseases, like acute myocardial infarction or stroke, it doubled in many cases. The system did not help the people to not be afraid. There was a fear by the population to come to the hospitals. Now that we are facing, at least in Europe, we're facing what some are calling the second wave, it's very important to organize the system in a way that we don't make the same mistake twice.
I think COVID, first of all, accentuated the gaps that we have in our healthcare delivery, highlighted the need to repurpose ambulatory and acute care services, and therefore introduce that flexibility. And it basically made blatantly obvious that we do need to invest more in our healthcare systems to safeguard, not only to safeguard people's health and well-being, but also to ensure that we have healthy people to restart and move the economy.
Yeah, I very much agree with what you said, Panos. COVID has been an amplifier of trend that we had identified, and of course, you alluded on signals in terms of fragility. There has been a re-rating of the strategic importance of healthcare. Panos, what do you think are the key things now to make the healthcare system more efficient?
What comes to mind immediately, or almost immediately, is three very key words. One is flexibility, second is adaptability, the third is repurposing. When we're talking about efficiency, for example, we know that whichever developed country you're looking at, about 10% of the patient population accounts for about 2/3 of total healthcare cost. And therefore, if we know who these patients are, we can target them and effectively target them positively, in other words, and effectively coordinate their care. So we're looking at coordinated and integrated care, which is quite critical in the context of a repurposed healthcare system. But at the same time, we need to have a focus on whole population health models.
I think probably for the last 10, 15 years, mostly in Western countries, but also in some emerging countries, we have been looking too much to healthcare expenses as a burden, a financial burden. I think the perspective is changing because, of course, society is evolving. It's obvious that a healthy society with people in good health, it drives positive economic impact. The way I view the evolution of healthcare is that it's going to be, of course, not anymore only about drugs, but it's going to be really making sure that we bring solution to the patient. Of course, it's important as well that the device are more and more biologics now as new drugs, and devices are playing an important role. And you see what I have in mind here with the introduction of digitalization, connected device. And of course, data are key.
I think what you're mentioning, Olivier, has to do also what we call now personalized medicine. And I think if there is something that this crisis, this COVID pandemic brought, was also that it kind of shaked us a little bit or a lot to make us think a little bit differently. And certainly to this approach, to have a more personalized approach to the patient and to be patient-centered, which we've been talking about for a long time, maybe this is now a very good opportunity to put it in place in a stronger way.
What we need to bring forward is a catalyst for new models of healthcare provision. And I think this is one of the key points I wanted to raise with regards to where healthcare systems are going in the future. So it is about working alongside local areas to redesign how healthcare is actually delivered. We can deploy obviously new technology and digital technology to and workforce models using dedicated transformation resources. But we also need to focus on higher value models. And there we're looking at population outcomes at a cost that the healthcare system can afford. That takes us into the whole area of reform in terms of using big data, in terms of using the technologies that we have in place, in terms of identifying higher risk patients and potentially intervening a lot earlier, with a view to improving healthcare outcomes further downstream. What I liked about your comment, Fausto, was the patient centricity. And I think the healthcare of the future is not the patient going to the hospital, but the hospital actually coming to the patient.
Yeah, Fausto, I would very much agree with what you said. I would add two comments. The first one is that I think there are unique opportunity for some healthcare system to leapfrog. Because what we are trying to build is, of course, the healthcare system of the future. And it's obvious that digital and data here are offering opportunity to leapfrog. The second comment that I would make is I believe very much in this holistic approach, more integrated approach between, of course, the GPs, the hospitals, the pharmacists, but also the patients play an important role. Holistic approach, everyone playing its role, but the patient remains at the core, of course.
I think one of the key issues that the pandemic has highlighted is the public's trust in the healthcare system. The healthcare system has shown that it's not only critical for people's well-being, but absolutely critical and essential for the return to normality so that our economies and societies can actually function. So we can actually go back to normality. We need to think differently about a number of critical areas in our healthcare system. We need to think about the hospital of the future and what kind of patients will go through the hospitals, the kind of repurposing that we need to look at. We need to look at the way that we manage our resources. We need to look at knowledge sharing and models of provision. The issue of digital engagement is absolutely essential and critical to move forward. So we've seen relatively poor uptake of issues such as telemedicine in the past. And I think nowadays with the pandemic, we're moving forward in the digital engagement agenda.
Well, I totally agree with you, Panos. And one of the elements is actually to create trust on the population, and that's the role of all of us. From the media to of course the medical community, the scientific community, the community as a whole. We have to create that trust so people can be treated for diseases and conditions that have treatment.
That trust is very important. I think it's a unique opportunity if we are able to continue to develop that trust to change what needs to be changed in the healthcare system. So Panos, Fausto, really enjoyed the conversation. Very much looking forward in a few weeks to a conversation of that kind with other stakeholders. Thank you.
Thank you. Thank you so much.
Thank you for the opportunity. Thank you.